Hi, I'm Pete McCall, the author of the recent ACE Certified article about how to increase testosterone levels through exercise. In this presentation, I'm going to give an overview of the article about how you can use exercise programs to enhance levels of testosterone in your older male clients. First, we want to point out that andropause is a real thing. As men get over the age of 35, their bodies can produce 1 to 3 less testosterone per year. This explains why you see so many commercials for testosterone replacement therapy during sporting events. It happens. Men will produce less testosterone. Also, this is a very important thing to understand. Excessive abdominal fat, excessive belly fat, produces an enzyme called aromatase. Aromatase will take free testosterone and convert it to the female sex hormone estradiol. Estradiol helps grow breasts. That's one of the reasons why men with large bellies or men with a lot of excessive abdominal fat will tend to grow breasts. It's because what testosterone their body does produce is actually turned into the female sex hormone. So if you can help your male clients, your middle-aged male clients, lose weight in their abdomen, that's going to be a huge step in helping them improve their testosterone levels. Another thing that comes along with andropause is sarcopenia. Sarcopenia is the loss of muscle mass. As you lose muscle mass, and we can lose about 10% of muscle mass per decade without weightlifting. As men lose muscle mass, their body loses the ability to produce and use testosterone. So if we can help our male clients maintain their muscle mass, we can help them maintain and enhance testosterone function throughout the aging process. So what factors influence testosterone levels? Number one, as I already mentioned, age. As men get older, they will produce less testosterone if they do not exercise. But what does enhance testosterone, what can increase testosterone, is strength training. Strength training creates mechanical stress. In the short term, the acute response of strength training is to increase levels of free testosterone. Over the long term, the longer your male clients stay with their strength training program, their body will produce more and more testosterone receptors. The way that hormones work, once hormones are produced from a gland, they have to interact with specific receptors in a cell, or else they just get circulated and flushed out of the body. Another important consideration with your male clients is that sleep. The body can produce testosterone during the deep REM cycles of sleep, which can help with the recovery and repair process. One thing that your clients should pay attention to, if your older male clients want to enhance their testosterone levels, they can consult with an RDN, but it's been shown that healthy fats, the mono and polyunsaturated fats, the healthy fats can help improve HDL, high density lipoprotein cholesterol. And HDL cholesterol is a component of testosterone, so the right diet, again, you should have a client consult with an RDN, the right diet could also help increase testosterone levels in your older male clients. So what is testosterone? Testosterone is an anabolic steroid. I know a lot of times we hear anabolic steroids and we think of athletes cheating. Anabolic means growth. It just means it promotes tissue growth. Catabolic means breaking down. Cortisol is a catabolic hormone. Testosterone is an anabolic hormone. A steroid is a hormone that interacts with receptors on the nucleus of a cell. A peptide hormone interacts with receptors on the membrane of a cell. So testosterone is an anabolic steroid because it works with receptors on the nucleus of the cell to promote tissue growth. The primary function of testosterone is to help muscle tissue repair, help muscle proteins repair after exercise. So when exercise damages muscle protein, the body will produce more testosterone in order to help improve the ability to repair tissue. That's one of the reasons why strength training is so important for older male clients, is because it can produce increased levels of testosterone naturally. Endogenous just means the hormones produced naturally by the body. And that's what you can influence. Your strength training program can help clients increase levels of testosterone naturally, endogenously in their body. Exogenous just means outside the body. A lot of times when we hear about athletes taking anabolic steroids, they're taking exogenous steroids because they're trying to use extra hormones to promote the tissue recovery. But with the proper nutrition, if your clients really want to improve testosterone levels, strength training is one way, proper nutrition is another way. They can consult an RDN in order to find out what they can do through their diet to help improve levels of testosterone. Here's some more information about testosterone. Number one, it's a male sex hormone. It's produced primarily in the Leydig cells of the testes. The major function of testosterone, what it primarily does, is helps with muscle protein synthesis. It repairs muscle proteins damaged during exercise. That's one of the reasons why strength training is so important, especially as your older male clients continue through the aging process. Research has shown that even men in their 70s can produce testosterone with the right exercise stimulus. Female clients do not need to be concerned about breaking out of muscles overnight. Because testosterone is produced primarily in the testes, women produce 10 to 30 times less testosterone than men. Women will produce some testosterone in the ovaries. Both men and women produce testosterone in response to the HPA, the hypothalamus pituitary adrenal axis. That's what stimulates production. Men produce it primarily in the testes. Women can produce it a little bit in the ovaries. All testosterone does is help encourage muscle protein synthesis and the repair of damaged muscle proteins after strength training exercise. So let's look at what exercise do influence testosterone levels. One, any major strength training exercise, compound lifts, squats, deadlifts. You see the picture of the tire flip there. The heavy strength training lifts with short rest intervals. There's been a tremendous amount of research on this, and generally working to the point of fatigue, somewhere between 6 to 10 repetitions to the point of fatigue, short rest intervals of 1 minute or less, has been shown to increase levels of testosterone immediately after exercise. Other things that can make a big difference are quality of sleep and nutrition. So if you have your older male clients, you can help them increase levels of testosterone naturally. Have them do strength training. Follow the ACE-IFT model. Use strength training from the load, speed, performance of the functional training side of the model. Have them strength train 2 to 3 days a week. Total body workouts, compound movements, squats, deadlifts, hinges, overhead presses, chest presses, barbell rows, pull-ups. The heavy lifts to the point of fatigue can influence testosterone levels. That's what the research shows. Also, high-intensity interval training has been very effective for increasing testosterone as well. There's one great study that I referenced in the article that took a group of men in their 60s and 70s, relatively sedentary, relatively deconditioned. They went through a HIIT training protocol, and these 60 and 70-year-old men did increase testosterone levels as a response of the high-intensity interval training. So what you can do as a personal trainer: strength training to a point of fatigue, 2 to 3 days a week. High-intensity interval training, 1 to 3 days a week. Pay attention to recovery and nutrition. Sleep is essential for helping promote testosterone growth in the body. So on those days that you have your harder workouts, make sure your clients can get a full night's sleep to get optimal recovery. If they want extra nutrition, nutrition can help support testosterone in the body. Have them consult an RDN in order to find out the ideal nutrition for there. For more information, read the article on ACE Certified and keep coming back to acefitness.org for all your exercise information needs.